I just came in and I got my first adjustment yesterday, and man, I just started feeling, I felt taller. It was weird. I felt like a sense of I need to drink more water because there's like more blood flow trying to increase, and I slept great. It wasn't, you know, I made sure to stretch before I went to sleep, but I mean, looking at everything in the more you look at everything here and in the charts of what is affected, it's like it clicked. Everything just started to make sense. You know, even as a kid, you know, I deviated septum because doctor didn't know. I just had sinuses, had to get a deviated septum. But I mean, if you look at my chart, you know, it's just stress on the top, stress on my my C1, and you know, I was like this. I had a Game Boy in the 90s, and it's just not great for my spine.
But that's the number one thing I hear from the first adjustment is people sleep better. That's the very first thing that I hear 90% of the time. The other thing I hear some is I was a little sore, but that's normal. Anytime you're moving bones into a new position, you're going to be a little sore, but that's fine. But you instantly sleep better, you have more energy, your body's healing better, so it's doing a lot better. So he's here today for his second visit, which is like his x-ray report. And we're not going to go through the whole thing, but we're going to kind of go touch on it so you guys can kind of understand what it is that we do. And so if you take a look, if you can take a look up here, here's his x-ray. And the first thing that stands way out is he has a little bit of curve right here, but then it just goes completely straight there. And it's supposed to be like that. It's supposed to be that nice banana shaped curve there that takes the pressure off the spinal cord, off the disc there, relieves that tension, relieves that pressure, takes away the headaches. Also, right here, this bone's called your C1, and it's very important that it's lined up properly. It's supposed to have a nice space between the occiput, the C1, and the C2, where I could put my fingers in there, and you can see there's basically no space there at all. If you take a look at this picture on the wall here, the very far one on the left, you can see that nice space and that nice curve. So, looking back here at Carlos again, he's basically in a phase 1 degeneration here, which is, you know, good that we've caught it when we have, because we can start reforming that curve, get those spaces to open up, get fluids in and out of those joints so they can be healthier and start healing. Otherwise, if he were to ignore it and say, oh, it'll go away, or just do something else for it, it's going to continue to decay here. It's going to continue to compress the disc, arthritis, degeneration, and a lot of other health problems that come along with it, because the whole spinal cord runs through that area and it controls your heart, your lungs, your liver, your thyroid, all those things. So there's no way that this can be decaying and not affect the rest of your body as well too. So that's why it's so important to take care of this spine, keep it healthy, keep it lined up, and keep it doing what it's supposed to do. And so let's take a look here at let's take a look at the low back, because you're having some low back pains too, right?
Yes, sir.
So here with the low back, you have a little bit of curve in there, but he's basically lost over 50% of the curve in there. It should be a nice 45-degree curve here, and there's a lot less curve than that. And then here, you don't see a very good disc space. This one's somewhat decent, but up in here, not so great either. It should be a real nice, clean, sharp edge with a dark spot that would indicate the space for the disc. Down here in L4, L5, and S1, not so much. And this is the most common area for people to have compressed discs, ruptured discs in the low back area. And then guess what? That squeezes the nerves here. It goes right into your sciatic nerve, right down into your leg, so you get pain down your leg, into your knee, into your foot, on the side of your foot, the bottom of your foot. And this is where it's coming from, right here. A lot of people don't know that. They think, oh, my foot's hurting, fix my foot. Well, this nerve being squeezed right here is causing that pain. So we have to fix this in order to fix the pain in the foot. So we'll look at a couple other here just real quick. This is his A to P view. And you can see, as I turn it back and forth, you can see it's not straight. It's got a wiggle to it. So it's a slight scoliosis in there. And then you can see here that the bone on one side is higher than the other, the hip bone. I'll put a little line there. And you can see it's a little lower here, higher here. And if you put a line right here, you can see how it curves over there. So we know the structure's not lined up properly. The nerves are being pinched up and down through here. So we want to do special adjustments to help line that up more too. Try to get that straighter, get it lined up better, get the hip level the same height, get all that lined up and moving and working the way it should. That's going to help his digestive system here work better, kidney, bladder, colon. It's rare that someone would come in with chronic low back pain and not have some type of issues over here, whether it be ulcerative colitis, Crohn's disease, colon cancer, prostate cancer, kidney problems, cyst on the ovaries, young ladies that can't get pregnant, all different things like that. And they didn't realize that these nerves here is what's causing those problems. So Carlos, I think you're going to survive here. We got some work to do with you.
So I'm 34 years old, and I've never been to any of this. I've come at a time, but I've never fully committed to it, and it's definitely worth the investment if you want to see your kids in the future. If you want to grow old, 34, 90s, growing up, we just rode bikes, fell out of trees, and then I went to a driving job for about 10 years, and I mean, look at it. I'm glad that I caught it at phase 1.
Mm-hmm. Absolutely, because the deeper the level the phase gets, the deeper it gets to the nerves, the more permanent damage you get, and it affects more of internal organs function as well too. So what if most people don't know what to do? They go to the medical doctor, they get pills for their stomach or their kidney or whatever it might be to cover it up, or surgeries. And did that really get to the source of the problem?
Yeah.
No, it didn't get to the thing that controls the entire body, which is the nervous system.
And I see a lot of parents, they see, like, where I work, they'll see their kids growing and they'll say, I used to be that tall. And it's true, they used to be that tall, but throughout the years of degeneration just started bringing it down.
Well, the discs that are between your vertebrae is a quarter of the spine height. And as you grow older, if you don't take good care of it, it begins to compress. They begin to dry out. And that's one reason you got to stay hydrated. You want to keep those discs full of water and hydrated. But as you get older, if you don't take care of them, they keep compressing and compressing and compressing and bulge out and rupture. And before you know it, there's no disc there at all. And there's a quarter of your spine height. That's why you see the little old ladies all humped over, and they're this tall, and they used to be this tall,
Wow.